And tell me, I love the name of your podcast. It's Medical Disruptor. So, what made you decide, okay, it's not enough just for me to learn this stuff and to help my patients, but I actually want to change the whole medical system?
I actually want to change the whole world.
Okay, I underestimated.
But I don't want to change the medical system. I want
Okay.
to recontextualize it. And that's a really good point because the medical system is great at doing what it does.
Hmm.
So my personal, well, not my personal, my professional progression was once I started realizing this, at some point I developed a functional medicine practice as many of us are wont to do. And I started seeing patients one-on-one and really had the honor of impacting people's lives in a way that it was so gratifying. It was so gratifying to see people who were just really just ushered out of the system, really disheartened, and getting them better together. It's not like it's not like from above. Getting it together, we got together. They got them better. But then after a while, personally, that became not enough, this one-on-one care, because a lot of it was also redundant. Like I heard myself saying the same things over and over again. And then I realized the messaging could get louder. And the podcast came, the TikTok came, and now I'm working on my second book. And the idea here, so my mission has become, and it sounds as one thing, but then I'll explain it as other. My mission has become specifically for women to never experience medical gaslighting again. Now, at first, this feels like, just as you said, to change the medical system. But that's not what it is. The medical system is doing exactly what it's designed to do, right? Which is to define disease and treat it, find pathology and treat it, and find a protocol and treat it. And when we have a disease or a pathology, oftentimes it has the best tools. Not always, but oftentimes it has the best tools. But many of our patients who are in the state of I don't feel good-itis are not going to be identified, classified, or diagnosed by that system.
Right.
So if I can empower our mutual listeners to understand that conventional medicine is wonderful, it's great, but it's just one tool. It's a division that's sometimes a department that sometimes we need to go to. And certainly if I have a broken foot, I want that. And if I have to get my appendix removed, I want that. And if I have pneumonia, I want that. So there's a place for it. It's certainly not, but once we contextualize it as just one tool, and understand that there are so many other tools that are validated and valid, including your own symptoms and your own body that is valid and we have to listen to, then you will never experience medical gaslighting again.